New research this morning finds a single gene may be critical to lowering your heart attack risk. Two medical studies identified a gene mutation that affects triglycerides, one of the main indicators of heart health. Our Dr. David Agus is in Los Angeles. Doctor, good morning.
Good morning, Charlie.
Tell us more about what these studies tell us.
Well, for the last 30 years, the way we've treated heart disease is by lowering LDL, which we had called the bad cholesterol. Now, two separate papers in the New England Journal of Medicine, two studies, show that triglycerides were just as important. And people who had a mutation in one gene called APOC3, well, this gene was meant to keep triglycerides up. And when it's mutated or turned off, triglycerides go down. And heart disease go down pretty dramatically in these people. So we now have, for the first time, a new target to prevent or delay heart disease.
So if they can figure out how to duplicate this mutated gene, then they're a long way to preventing heart attacks?
No question about it. There's actually a drug now in development that hits this gene and turns it off, and it lowers triglycerides in patients. We've yet to see whether it prevents heart attacks, but there's certainly a lot of hope.
This is fascinating, Doctor, because we know that heart attacks are the leading killer in the United States. We currently have statins, which help, but there hasn't been a new drug for decades, right?
No question about it. 600,000 deaths a year. And, we now have something we could target. And it's really exciting how they came about. Historically in medicine, we throw out the outliers. The physics, they look at the outliers, and they made many of their great laws. Well, there was a group of Amish that had very low triglycerides and low heart disease. And in fact, when they would eat a milkshake, their triglycerides wouldn't go up. And it was originally shown in these people, this particular gene, and now we know the exact mechanism and we can target it.
All right. Thank you so much, Dr. David Agus.